country continues to mourn for those lost in the Sandy Hook Elementary shooting. There are calls for better mental health resources. New tonight, News 2's Joseph Pleasant talks to the top mental health official in the state.
In the wake of events like the Sandy Hook Elementary shooting, the mental health of the assailant becomes a focus as people try to make sense of the tragedy. In addition to calls for changes to gun laws, many are calling for changes in the mental health industry.
Everyone's looking, I guess, at many levels on public policy, funding issues, and all those kinds of things. But the real answer, in my opinion, lies in a more fundamental approach.
Tennessee's Department of Mental Health services around 250,000 Tennesseans. Commissioner Douglas Varney admits resources are lacking, especially in rural areas. The department is in the process of rolling out a statewide plan to fill some of those service gaps. Tennessee is one of 15 states awarded a 4-year, $4 million grant to fund the project. But according to Commissioner Varney, that's only a partial solution.
This is a complex problem. Each one of these situations are unique. And if you overgeneralize, in fact, I think you'll create a worse problem rather than providing any comfort or security or safety.
The commissioner says some meaningful changes to the way Tennessee deals with mental health issues could come from the Capitol. But he says the most impactful changes happen at the community level and with the people closest to those suffering with mental disorders.
And really, if you're going to have any chance at all of engaging them in any kind of effective way, it has to be somebody that they know and trust and somebody from their community.
Because that voice of reason may be the best way to convince the person to get help if they're struggling with mental illness. Near Metro Center, Joseph Pleasant, Nashville's News 2.
Around half of the people with mental disorders started to see signs before the age of 14. The local nonprofit organization Centerstone counsels children and teens in schools. Counselors tell us the stigma that goes along with mental illness can prevent people from seeking help.
Think about other children that may be the same age as your child, and how far are the behaviors that you're concerned about, how different are they from their same age peers?
Well, experts suggest parents limit how much coverage of the Sandy Hook shooting their children see. If your child is scared, they say to have an age-appropriate conversation that's reassuring.